Okay, wonderful. All right, and I'm going to make you our spotlight, Dr. Worry.
Oh gosh.
There you are. All right, everyone. Welcome again to our general cancer support group through Cancer Bridges. And we're excited to have Dr. Joseph Worry, James Joseph Worry, I have on here. He is a board certified PA in the exclusive practice of dermatology for more than a decade. He's a fellow of the Society of Dermatology Physician Assistants. Dr. Worry holds a doctorate of health science from Nova Southeastern University and a master's of physician assistant science from St. Francis University. Since 2011, Dr. Worry has focused his practice on general and surgical dermatology. Outside of the clinic, Dr. Worry serves as an adjunct assistant professor at the University of Pittsburgh School of Health and rehabilitation scientist, which I've just heard a lot about in the last couple of years, which I think is fascinating. And he also serves as the president of the Pennsylvania Dermatology PA Society. That's a pretty big role too. Additionally, Dr. Worry is nationally recognized for his dermatology expertise, serving as a clinical consultant, author, expert witness, and accomplished speaker. So we are very thrilled to have him. This is a topic that's near and dear to my heart just because I love the sun and for many other reasons to be able to take care of our skin. It's an important part of our body. So we welcome Dr. Worry.
Hello, everyone. Accomplished speaker puts a lot of pressure on me, so we'll see what I can do for you here. Thank you so much for giving me your time and involving me in the organization. I'm really excited. And the way it came about was through one of my long-term neighbors who's a member of the group and is a cancer survivor and constantly battling health issues. And she told me about the group and I was excited, and I thought, skin cancer is becoming terribly prevalent and happening in younger and younger people as well. So maybe if we took a half an hour or so to talk about this, and also just to look at some pictures of skin cancer, so that if you see something on a friend or a family member on their back, you don't want to be afraid to say something to them, because a lot of times, it's somewhere you can't see, and you can actually really help somebody, because this is the only cancer that starts growing that we can see before our eyes, and it doesn't take a special test, it doesn't take an x-ray or blood work, it's all just visual. So you can't hurt anybody by saying, did you know you have a spot on your back? And you may actually just help someone. So the way I like to start out with this one is just a quick, a little vote amongst the group, and you can pick here. One of these lesions on the first picture is melanoma, which is a very deadly skin cancer. And one of them is completely benign. So I just need to take a minute to look at the characteristics of them and take a silent vote and think in your mind which one you think is the problem and which one is not. And hopefully by the end of our lecture, we'll all be able to have chosen the right one. But you can see they're both kind of irregular looking, dark brown or black. One's a little bit raised, jagged. So they look a little off. And there's some subtleties amongst them too. But one is problematic and one is totally fine. And I want to give you the full disclosure. I've got two rowdy boxer dogs around me right now, and they're being pretty well behaved with treats, but this is my current view. So this is Bernadette. And she's our co-host, and she's right behind the computer screen looking at treats as I try to keep them quiet. I do work for some pharmaceutical industries, but they do not make drugs that we use to treat skin cancers. So there's no conflict here, but in the interest of being completely transparent, I do partner with these companies. For our talk this evening, we're going to talk about the history of tanning. How did we get to the point where everybody likes to have tan skin? Just the basic structure of our skin, how the UV radiation, either from the sun or indoor tanning, interacts with our skin, and why that's dangerous. And then we'll kind of get into the real meat of the conversation with these different growths that can occur because of sun exposure. Actinic keratosis, which are precancerous cells, squamous cell skin cancer, basal cell skin cancer, the big scary one, melanoma, and what we can do to help ourselves and prevent skin cancer by doing skin checks at home or getting skin checks at the dermatology office, by picking the right sunscreen and being safe when we're outside, and then we can answer some questions. There was already some talk about, not related to the sun or skin cancer, but maybe how to deal with things like irritation of the skin from radiation. So if things like that come up at the end, we could certainly talk about that if we have time. So how did we get here? The Victorians really valued fair skin, and they covered, look, these women have parasols, long sleeves, and hats. And at some point, something happened where we now have arrived, and we're at Dolce & Gabbana, tan on the beach, totally exposed, sexy tan skin. So what has happened to change this? And basically, what has happened is that there was a change in perception of what it meant to be tan. So initially, upper class people in the early 19th century, they wanted to be fair because it meant that they were wealthy enough to live inside and that they had staff to go out and to work in the fields and do things for them. So they weren't laborers, they were inside and they were fair. We know the woman named Coco Chanel who really revolutionized fashion, and she went on a vacation and she came home with this beautiful tan, and it really started frenzy, in the newspapers and in gossip about her tan, and so people wanted to emulate or be like Chanel because she was a very glamorous woman. And what happened is it became a sign that you were wealthy enough with the invention of air travel to afford plane tickets to go to exotic places. So if you showed up in the middle of winter and you had a beautiful tan, people thought, wow, she really must be somebody. She must have some money. She's gone on a trip and she's been in the sun and is now tan. So the souvenir tan idea came about, and it really stuck. And then there were those of us who live on a budget, and so people wanted to be tan on a budget. And a very famous physician named John Kellogg, who also invented the cereal, invented the tanning bed. And this UV tanning was an artificial way for people to get the same tan on their skin, but it also came with a lot of problems as well. When we look at the skin, just the basics here, we have an outer layer of skin cells, which are kind of dead, and they waterproof our skin. We have basal cells, which are at the very bottom layer of the skin. Squamous cells, which are kind of sandwiched in between. And these are from which, obviously, basal cell and squamous cell skin cancers will arise. Melanoma, which is a skin cancer of the cells that make pigment in our skin, happens in the deeper layer of the skin, which is called the dermis. And what we can see here is at the bottom, the kind of dark blob, which is called a melanocyte, creates a pigment called melanin in our skin. And we all have the same amount of melanin in our skin. The same amount of melanocytes in our skin, whether we're very fair or we're very dark, we have the same amount of melanocytes, but they produce pigment more. And you can see the little kind of peppery looking speckles above the melanocyte, the cell that makes the pigment. Whenever sunlight hits a melanocyte, it stimulates it to make the dark pigment in our skin. And the pigment you can see goes directly up because the DNA that is in the melanocytes is easily damaged by UV radiation. So the cells are very smart. They make the pigment right above themselves to act like an umbrella to try to protect the DNA. But the radiation from the sun can sometimes damage the DNA of the cell, and this is how we develop skin cancers. Everyone can get skin cancer. There is unfortunately not enough education in the medical world or in the general world. And sometimes people with a darker skin tone and people of color wrongly assume that because they're darker or they tan easier, that they can't get skin cancer. Everyone can, unfortunately, get skin cancer. But those of us who have a fair skin type, blonde, redhead, blue eyes, people who burn easily, have a little bit of a higher risk of skin cancer. It is less common in darker skin tones, but it does still happen. And what happens with UV radiation? There are different types of UV radiation, 3 types. UVC, which is very detrimental, is fortunately for us filtered out by the ozone layer. It doesn't reach the surface of the Earth. UVA radiation causes aging, This causes us to wrinkle, get sunspots, cause changes to our elasticity of our skin. So this is what makes us look older. UVB is what causes us to burn. This causes the redness in our skin. So this radiation can come naturally from the sun, or it can also come from tanning beds. We know, based on some really authoritative agencies, that UV radiation is dangerous. It is non-ionizing radiation, and it is a carcinogen, which we know means it causes cancer. And a lot of people tell us this. The International Agency for Research on Cancer tells us UV radiation is bad, the National Toxicology Program, and the US Surgeon General. And in fact, now on tanning beds, there is a warning from the Surgeon General, just like on cigarettes, that this device is known by the Surgeon General to cause cancer. And the pattern of our sun exposure, whether we get cumulative, a little bit of sunlight throughout our life every day adding up, or whether we have really intense and intermittent sun exposure and burns, can make a difference in the type of skin cancer we may develop. So those of us who maybe work outside, or had occupations right outside, or drive a lot, get low levels of chronic radiation every day. That can cause what's called basal cell or squamous cell skin cancers. They're relatively common. And those of us who may work inside, but on the weekend we go out to the beach and we get a really bad burn every weekend, they get intermittent sun exposure. That can cause melanoma, which is a bit more aggressive. We know that the sun sends energy to the earth, and we feel that and see that in different ways. The visible light that causes daylight, we can see, but there's infrared radiation, which we feel on our skin as heat, but we're unable to see that. But these are both radiation. How we can know how strong the radiation is each day, we can find on our phone under the weather app or on the news, is called the UV index. And this is a forecast of how much radiation we're receiving that day. And it goes from 1 to 2 on a very cloudy, overcast, rainy day, all the way up to 11. The higher the number, the higher the amount of radiation, the more exposure we're receiving. So on very high days, it's important to really take extra steps to protect ourselves as well. So as if we weren't trying to scare you enough about just being in the sun and living day to day, there are some people who deliberately try to get extra radiation and extra tan. And indoor tanning is really, really very dangerous. The radiation from indoor tanning beds causes skin cancer at a much more accelerated rate than tanning outside. And they say, in fact, just one indoor tanning session before the age of 35 will increase the risk of melanoma by 75%. That's a really dramatic number. One time, 10 minutes, 75%. And think about how many young people, particularly young women before prom, want to go tanning, children or grandchildren, these girls many times want to be tan. And until a few years ago, that was actually something that could happen. If your mom or your dad signed a waiver, you could go tanning at a tanning salon. But now, like cigarettes or alcohol, the Surgeon General has restricted tanning to 18 years and older. And in some countries, it's entirely banned. So the International Agency on Research for Cancer, which is from World Health Organization, actually has said that this is carcinogen, this causes cancer, there's no doubt about it. And actually, more people develop skin cancer from tanning than those who develop lung cancer from smoking. So we already know how bad smoking is for you. If you can imagine something even worse, here we are. Indoor tanning is not safer. A lot of times people think it is because they feel like it's a controlled environment, but it actually emits 15 times more radiation than you would receive on an entire day at the beach in the middle of the summer. And sometimes people come in for checkups with me and I say, wow, you're really tan. And they say, thank you, but I'm going on vacation. So they think if you tan before, you get this sort of base tan to protect yourself. But that's only equivalent to an SPF number 4. And we know if we put on an SPF number 4 suntan lotion, that doesn't really do much anyway. So you really hurt yourself more than not. So indoor tanning hopefully will continue to fade out in its popularity, especially amongst young people who are most vulnerable. But we still need to make sure that people know this is not a healthy alternative to the sun. But people say, I need sun to make vitamin D. And it is true that the sun helps us make vitamin D in our body. World Health Organization suggests 5 to 15 minutes of sun 2 to 3 times a week. In people who have skin cancer or who are at risk for that and very fair, we actually advise against deliberately tanning for vitamin D production, because now it can be supplemented with vitamin tablets pretty easily. But the risk of tanning, again, sunburn, premature aging, some medicines interact with the sun and cause pretty nasty rashes. Eye doctors are very concerned about UV tanning because it can cause a number of eye problems, including melanoma in your eye. And of course, from the dermatology perspective, we're worried about skin cancer. That's sort of the background now that we're all free to go outside or be in the sun, but that's how we arrive at these things. So the first thing we're going to talk about is very common. These are called actinic keratosis, and they are precancerous cells on the skin. They kind of feel like rough, sandpapery, scaly, scabby things. They may go away and come back, but they're persistent. They're in the same area, and they're on areas of sun exposure: ears, scalp, face, chest, or arms, places where you may get sun all the time. And why we get worked up about them is that it is a precancerous cell, and we know that over time they will degrade and they will turn into a type of cancer called squamous cell, which requires some type of intervention to fix. So when patients come in for a checkup and I see they have a good bit of sun damage, I feel their skin and I feel for roughness or sandpaper texture. And if I start feeling these things or seeing little scabs that just don't go away, the goal is to get rid of it. Whether we freeze them with a cold spray, we put a cream on them, we do a laser treatment, whatever it is, we just want to recognize they're there. And I always tell people, we're going to clean up your act a little bit. So we're going to try to get rid of some of these precancer cells and decrease the burden or the likelihood of you developing a skin cancer. These are what precancerous cells look like on this gentleman's head: rough, scabby places, forehead for this lady, and the close-up picture on the bottom. Any type of rough, scaly thing that doesn't go away in a sun-exposed area should cause you to think, could this be a little precancerous cell that, although not an immediate urgency, should be taken care of at some point. Many of you, if you've been to the dermatologist before, you may have seen this. This is our sidekick, the little spray gun. People call it a blowtorch, but this we used to spray a cold gas on these spots and get rid of them. And it's a familiar nemesis to a lot of people who enjoy the sun. So the actinic keratosis or the precancers are important to us because they can develop into a squamous cell skin cancer. And this is a malignant tumor or cancer of the cells that waterproof our skin in the outer layers of our skin. But it can also happen in the eye, your lips, your mouth, genital areas, anywhere where we have these squamous cells that line our skin or different areas of our body. They don't typically spread or metastasize, but it is possible, especially in folks who may be sick or have other problems going on. Their immune system may not fight this as well, and it can spread. As we get older in life, we've just had more time around the earth and around the sun. And so the more cumulative sun exposure you have, the higher your risk. Typically, men get these a little bit more than ladies, and that is changing. It was initially felt like because, traditionally, maybe men had jobs where they worked outside a little bit more, but those types of changes are sort of evening out, and ladies certainly develop these things as well. They can run in people's family, and for those folks who have had organ transplant, like liver or kidney transplant, they have to take some pretty strong medicines to keep themselves healthy and prevent the rejection of their transplant or heart transplant. And those medicines can cause people to develop skin cancer much more rapidly. So when I have patients who are awaiting an organ transplant or who have had an organ transplant, a lot of times they're transplant coordinators and the nurses, they're sending them to me to have checkups before they get a transplant to say their skin is healthy, and they come very regularly afterwards. And it's just an unfortunate side effect of the medicine is that they develop skin cancers quicker than they should. So be on the lookout for a spot that's one spot, and it could be kind of crusty or eroded or worn away. It may be an ulcer, a sore, or something that blisters. Our job is to recognize that you have a spot that's not getting well or going away, and that it's sort of different than the others, and is to take a sample of it and to recognize that. We take a little biopsy, we confirm if that's the problem, and then we treat it in a variety of ways. Some of them I just kind of cut out and put in stitches in the office, and that's it. Sometimes we can scrape them or burn them off. Sometimes we treat them with radiation or different therapies. But our goal is to recognize a spot that's not healing and to take a biopsy of it. Anything that doesn't heal up should really prompt a concern as to what's the reason why. These are some pictures of squamous cells, and you can see they can happen in sensitive areas like the genitals, the eyelids, the mouth, or on the nose. And these are all kind of chronic sore wounds that just don't get better. Switching gears just slightly, this is called basal cell. This is the most common skin cancer in the world, and certainly one of the most common cancers in the world. It's a cancer of the basal cells of our skin, which are at the very bottom layer of the layers of our skin. Again, it's more common in fair-skinned people, people who've had a lot of sun exposure. Back in the day when, for acne, dermatologists used to treat people's acne with x-rays, believe it or not, and that did really well. It worked for their acne great. But then years later, all these young people who had x-rays for their acne started to develop skin cancer. So now we realize, oh geez, maybe giving people a lot of x-ray radiation for acne was not a good idea. So sometimes treatments that we do meaning to help, we can find out later actually are problematic. Sometimes these run in people's family. And obviously, if you live in an area that's a bit sunnier than others, closer to the equator or south, you get more sun. There are many different types of basal cell, and the exact types don't matter to us so much. But again, we're looking for a spot that's tender or sore, growing or not healing. And you should be suspicious if that happens and have somebody take a look for you. A little biopsy is very simple to do, and it will give you peace of mind, or it will help us to determine the best thing to do to take care of it. And that again, maybe freezing it, scraping it, doing some surgery on it, or sometimes there's even topical medication that we can use. So again, a spot that's not healing up should be a little concerning. These are all basal cells. Some of them look a little scarier than others, you know. The upper left, that one really stands out to you. But look at the gentleman's nose on the upper right. That's very subtle and hard to see. So dermatology providers are typically very good at fine details. Not much in the way of detail, I think, gets by me. And at home, that can be problematic. But in the office, that's quite good because there's subtlety to this. But this little spot looks like a scar. And it is indeed a type of skin cancer that's just a little bit more subtle. So those are sort of the two more local skin cancers. And where we're going to focus our attention is melanoma. And this could be a really aggressive type of skin cancer. It's becoming more common in young people. And it can be an unfortunately deadly type of skin cancer that can spread to our lungs, our brains, and different areas. When I have patients who have problems like this, depending on if it's more progressed or not, sometimes if it's early, we can just cut it out in the office and be done with it. And thank God that's when we want to try to catch it. But sometimes they're a little bit more progressed. And these are the patients who end up going to the Hillman Cancer Center or receiving other treatments like this. So we want to try to catch melanoma early when it's completely fixable. We know that, again, people who burn more easily than those who tan more easily are at risk for melanoma. So lighter skinned people who burn easy. And what happens again is that this is a malignant cancer of the cells that make the pigment in our skin. Men are a little bit more at risk than ladies, people who are fair skinned. And if you had sunburns as a child, sunburns before you're a teenager are strongly associated with melanoma. And so when we're young, you know, people my age and a little bit older, you know, we played outside and we got a lot of sun, but we were lean and skinny and healthy there. And so now what we're seeing is kids are staying inside more now and playing video games. So they're getting less sun exposure, but then they're having trouble with things like obesity and sugar trouble. So it seems like every generation gets kind of hit with one thing or the other. But what we know now is that we have to protect children from sun exposure. So even little kiddos, we need to goop them up with sunscreen and cover them up, because it's hard to believe, but the sun as a child is what can get you later in your 40s or your 50s. People who have a lot of moles are at a higher risk for melanoma, and people who have very large moles or irregular moles. And there are many types of melanoma, but all of them are going to be either an existing mole that has somehow changed size, shape, or color, or a brand new mole. You know, as adults, we really shouldn't be making many new moles. I always tell people to be on the lookout for sort of an ugly duckling. Your moles should all kind of look the same. And if there's one that looks different than the others, that should stand out to you. So if you see something that's changing or different, again, seeing somebody at a dermatology office is very important. And we typically will take a biopsy of it to look at the lab and see if there's a problem. And if there is a skin cancer problem like melanoma, the treatment depends on a lot of different things, but predominantly it depends upon how deep or thick that melanoma is and has it grown into the skin. If they're on the surface, a lot of times I can just cut them out in the office and that's the end of it. If they've grown deeper, then sometimes we get into procedures that are a little bit more aggressive, invasive, or scary, like removing lymph nodes, having PET scans and CT scans, because we have to check to see if this has spread or not. Besides surgery and the lymph node biopsies, sometimes we treat people with chemotherapy or what they call adjuvant therapy, which are medicines that try to work with your immune system. If the tumor has the right DNA or genetics to it, there are medicines that can work with the immune system to try to fight it. And oftentimes, you know, we are working with oncologists and surgeons, and it's a whole team. So like many cancers, prevention and early detection is very important here. And it's called the ABCD, and recently we've added E. So ABCDEs of melanoma. Is it asymmetric? Does it have an irregular border? Are there multiple colors to it? Is it larger than the top of a pencil eraser? Or is it evolving? Has it somehow changed over time? If you notice those things, you see your dermatology partner and help to figure out if there's any concern there. And I think because dermatology is such a visual field, spending a moment just to look at some photos of different types of melanoma is really important, because I'm not particularly a genius, but you know those games where you look at two pictures and find the thing that looks different in the one picture? That's what dermatology is. It's finding the mole that looks different than what the picture should look like. So if you're good with detail, you're good for dermatology. You can get melanoma under your nail, which looks like these streaks or bands. You can see this one that says superficial. It's jagged and irregular. It's not symmetrical. The person with the melanoma on the face, again, this is very large. It's different colors. It's different patterns. These all just look a little off. They're not picture perfect. But look at this one in the middle, not to scare people, but it is a scary form of melanoma. We think of melanoma as being a black, dark mole. This pink patch is melanoma that's called amelanotic. It produces no color. And because of that, it's very deadly. There's nothing to tip us off that this is something wrong. You may think this is eczema, this is a rash, you know, but it doesn't get better. If you came to me and said, I have a spot, say, okay, maybe it's eczema, and we put a cream on it for a week or two, and it doesn't go away, then you have to take a step back and think, well, why is it not going away? And that's when we investigate a little bit further. You can get melanoma on your foot, on your hand, in your eye, all different places that we don't think about, but they all just look, for the most part, a little bit off, a little funny, a little irregular. And melanoma under the nail can be aggressive, and it can happen a bit more in people with skin of color. In fact, Bob Marley, you know, the very famous musician, died from melanoma because he had skin cancer under his nail. And as a Black man, not many people took the time or the thought to think that, you know, a Black person in particular getting skin cancer like melanoma could happen, but under the nail, which is very rare. So because of that, it went unrecognized, and then he didn't treat that. So it can be very subtle, or it could be more dramatic. These are patients of mine with melanoma, and you could see this is somebody's back of their neck, and they have, this is an ugly duckling on the back of the neck. Lots of little brown freckles, and then that one that really stands out. And there are those of us who should know better. This is someone's foot, and this is actually a nurse that I know from the hospital. And she said, I have a freckle on my foot. You know, she's very fair, and look how that stands out in the background. But there are even those of us who have some, you know, a fair amount of medical training, and we don't always think that that could be a problem. So this nurse had an early melanoma, thank goodness, and a good outcome, but it had been there for a while, and she wasn't thinking much of it. You know, it was just a casual conversation. Hey, look at this spot. These are patients of mine as well. This gentleman has melanoma on the back of his neck, and it is a kind with no color. So we don't see that dark, irregular mole. But boy, that just certainly doesn't look right, you know, if we have an index of suspicion. And here's a melanoma on the abdomen. Look at all the little brown freckles, and then this dark one really standing out again. A melanoma on the belly, a patient of mine, it's bleeding and sore. It just doesn't look right. And fortunately, we were able to cut this out, and I took this one out for him and sewed it up, and they done quite well. This is a very bad lesion of melanoma. This patient came to see me at about maybe 10:30 or 11 in the morning and said, I have a pimple on my leg, and then took off his pants and showed me this. So, you know, that's very shocking. Look, we have pink, brown, black, raised areas, irregular. And this is a very aggressive melanoma, a bad melanoma. So I said to him, we wanted to get this off right away. And I said to him, you know, hang around, stay here until lunchtime. And I'll take this off of you at lunchtime because I wanted to get it off of him right away. And it took the whole hour lunch. It was a really large surgery to remove this for him. But unfortunately, as you could see, his was pretty raised and advanced. You know, he did end up needing to go to the Hillman Center and have additional treatment. But I wanted to get that off of him immediately and not let him go another day. So we hung out during my lunch break that day. So checking your skin at home is important, and we should do that once a month. But checking your skin with somebody in the office is also important because it's hard to see our back. There are some subtleties to it. So it doesn't hurt to have somebody look. And dermatology checks tend to be people's favorite. We don't shove you into a tube and x-ray you. We don't take blood or smash your boob. You know, we're just looking with our eyes, and it's a pretty quick and easy, painless thing. So you should get examined head to toe and not be shy or embarrassed. We definitely work to keep you covered and be modest, but we need to look everywhere. So you're going to get changed out of your clothes and put on a gown, and the nurse and I look, and you know, we use bright lights, we use little microscopes, so you can, you know, sort of feel like a little bit of a specimen. But I always tell people when I'm looking at your skin, I'm looking at you in sections this big as I move along. So, you know, yes, it's a little weird to have your clothes off with a stranger, but we're just looking in little sections, and we try to talk and make it as casual and comfortable as we can. So don't let that hold you back. You know, there are some people who are just embarrassed to get changed, but, you know, it really could save your life, like many of the other tests. And it goes by pretty quickly, and it's not all that bad. When you come in to see the doctor, you know, sometimes people come in and they've got on all their makeup and they look great, but we can't see your skin. So it's not a fashion show or a night out with the girls. It's the doctor's office. So, you know, you don't want to wear makeup. You don't want to wear a bunch of jewelry or clothes that are hard for you to get out of. Come, you know, knowing that we're going to take everything off. And if there is something suspicious, we may take a little sample of that. When you're at home, it's good to check your skin once a month. When you get out of the shower is the best time. And you just want to be sort of symmetric and systematic in the way you do it. If you pick one way and do it the same way every time, whether you look head to toe, up or down, front to back, you want to make sure that you are doing it in a way that's consistent.
We lose you. Are you there, Dr. Murray? Hello? I don't know if can you guys all hear me?
I can hear you, but not him.
Okay. Oh, I think he's coming back.
He's coming back.
Okay, here we go. Hello, Dr. Worry, are you there? Uh-oh. I don't think he knows we can't. He doesn't know we can't hear him. Dr. Worry, can you hear us?
There we go. I
Okay,
can now.
you're back.
Yeah.
All right.
Okay.
Cool.
Sorry, we're clear. We're near the end. I thought you got sick of me. I don't know what happened.
I know you disappeared.
But we're almost there. I was on my break. So the last thing I was saying was the skin check, pick a way to be symmetric, do it the same way each time, check behind your ears, between your fingers, between your toes. And if you do it the same way each time, you won't miss a spot. So it's good to just have a pattern that's easy to remember. And try to protect yourself from the sun. Any medicine or anything at the store where we have the black box around it is a drug, and that is regulated by the Food and Drug Administration. And this was not the case for sunscreen for many years. And we are all can remember there used to be SPF 110. And so people would put that on one time and think they were good for a week. But SPF 30, SPF 110 is no better than 30. Once you get to 30, there's no difference. And you want to look for sunscreen that says it's broad spectrum, which means it prevents radiation and burns from UVA and B. You should try to find one that's at 30. And you should try to find one that also has zinc or titanium. The mineral sunscreens, I think, work a little bit better. They're completely natural. And some of us are hesitant to use chemical-based things with different health concerns. So the mineral sunscreens are completely natural, and they'll have zinc or titanium, easy to pronounce ingredients. The chemical ones, like in this picture, avobenzene or oxybenzene, the ones that sound crazy are clearly chemicals. And they're fine, and certainly better than nothing. But we think the mineral, zinc or titanium, is probably a little more effective. And make sure you reapply this every 2 hours. You want to use a generous amount. They say about the size of a shot glass should cover your whole body. Apply it before you go out, and make sure you reapply it every 2 hours. If you're swimming or sweating a lot or drying off with a towel, it rubs off. So sometimes we get to have fun. We're at baseball games or at the beach and we forget to reapply it. And that's when you get burnt. So every couple hours, you have to reapply it. And a lot of people ask what SPF stands for, which is sun protection factor. And so as a simple explanation, if I could go in the sun for 5 minutes before I get red with nothing on my skin, when you apply SPF, it means you can go out 30 times longer if it's an SPF 30 and not get red than you could with nothing. So it's just a measure of how long we can prevent redness from occurring in the skin as a way for us to determine how it's working. So to finish up, how many of you would have picked the spot on the left, the flat spot? I think that it looks a little less dramatic or problematic than the one on the right, the raised one. Most people pick the one on the right, but the one on the right is entirely benign, and it is a growth called a seborrheic keratosis, and it's a collection of dead skin cells. It'll never hurt you in a million years, but it looks bad. The one on the left is flat. I don't think it looks that bad. That's the melanoma, the potentially deadly one. So there's subtlety in this, but it's recognizing that maybe one of these things is new or different. And the one on the right can be a godsend for a lot of people because it's raised and it looks ugly. So sometimes people kind of like, I have this ugly mole here, and it's a benign, totally fine thing, but hiding out next to it is the real problem. So sometimes they just get you in the office and they're perfectly fine, but we come across something a little bit different. So that's the knowledge and what I know to share with you folks about these skin cancers. And I'm very thankful for your time and any experiences you have to share with me or questions. And I'm happy to learn from you as well. And we could chat a little bit if you like.
That sounds great. Thank you so much for that amazing presentation. I've seen a lot on skin cancer, but I've learned a lot of new things actually. So that's awesome.
Now we're all going to be vampires, right?
Yeah, exactly. Oh my God. So I'm going to stop the recording, and then I'm going to have you stop the screen share so everybody can ask questions. So